Tretinoin is a medication that is used to treat a specific type of cancer called APL, or acute promyelocytic leukemia. This type of cancer causes an overproduction of abnormal blood cells, which can lead to symptoms like infections and fatigue. Tretinoin works by stopping the growth of these abnormal blood cells and may help reduce the symptoms of APL. It belongs to a class of drugs called retinoids, which are related to vitamin A. It is important to take this medication as directed by your doctor and to follow their instructions carefully. The daily dosage and optimal timing for taking tretinoin will vary depending on your specific condition and medical history, so be sure to consult with your healthcare provider for personalized guidance. When taking tretinoin, it's important to follow the instructions provided by your doctor or pharmacist. Take the medication by mouth with food, usually twice daily. Swallow the capsules whole with water and do not chew, dissolve, or open them. If you vomit after taking the medication, do not take another dose to make up for it. The dosage of tretinoin is based on your medical condition, body size, and how you respond to the therapy. It's important to use this medication regularly to get the most benefit from it. Try to take it at the same times each day to help you remember. Do not increase your dose or use this drug more often or for longer than prescribed, as it will not improve your condition any faster and may increase your risk of serious side effects. It's also important to note that tretinoin can be absorbed through the skin and lungs and may harm an unborn baby. Therefore, women who are pregnant or may become pregnant should not handle this medication or breathe the dust from the capsules. Some common side effects of tretinoin may include headache, dizziness, fever, weakness, tiredness, dry mouth, dry skin, thinning hair, nausea, vomiting, itching, bone pain, mouth sores, increased sweating, and earache. If any of these effects persist or worsen, notify your doctor or pharmacist. You may experience headaches a few hours after taking a dose of tretinoin. Over-the-counter pain medications like acetaminophen can help relieve these headaches. They should go away as your body becomes accustomed to the medication. Talk to your doctor about the best pain relievers for you. To relieve dry mouth, you can suck on sugarless hard candy or ice chips, chew sugarless gum, drink water, or use a saliva substitute. It's important to remember that your doctor has prescribed this medication because they have judged that the benefit to you is greater than the risk of potential side effects. Many people using tretinoin do not experience serious side effects. Notify your doctor immediately if you experience any serious side effects, such as stomach or abdominal pain, yellowing of the eyes or skin, dark urine, hearing problems, signs of kidney problems, or mental/mood changes like depression or anxiety. Seek medical help right away if you experience very serious side effects, including nausea or vomiting that doesn't stop, severe headache, vision changes, chest pain, weakness on one side of the body, trouble speaking, confusion, or pain, redness, or swelling of the arms or legs. While a serious allergic reaction to tretinoin is rare, seek medical help right away if you notice symptoms such as rash, itching or swelling of the face, tongue, or throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. If you notice any other effects not listed above, contact your doctor or pharmacist for advice. Tretinoin can have serious side effects, even fatal ones, especially within the first month of treatment. Your doctor will closely monitor you to reduce the risk. If you experience symptoms like fever, trouble breathing, unusual tiredness, weight gain, swelling, dizziness, or fainting, notify your doctor immediately. They may need to temporarily stop your treatment. This medication can also cause serious harm to an unborn baby if used during pregnancy. Before starting treatment, you must have a negative pregnancy test and continue to have monthly tests while taking this medication. Women should use at least 2 reliable forms of birth control during treatment and for 1 month after the last dose. Men should also inquire about reliable forms of birth control during treatment and for 1 week after the last dose. If you are planning, become, or suspect you may be pregnant, inform your doctor right away. Before using tretinoin, make sure to inform your doctor or pharmacist about any allergies you may have, especially to vitamin A-related drugs. This medication may also contain inactive ingredients that can cause allergic reactions, so be sure to discuss any concerns with your pharmacist. Before starting this medication, talk to your doctor about your medical history, particularly if you have liver disease, heart problems, or mental/mood problems. Tretinoin may cause dizziness, severe headaches, or vision changes, and using alcohol or marijuana can increase these effects. It's important to avoid driving or using machinery until you can do so safely. Limiting alcoholic beverages and discussing marijuana use with your doctor is also recommended. For children using this medication, there is a risk of increased pressure in the brain. If your child experiences symptoms such as severe headaches, persistent nausea/vomiting, or vision changes, seek medical help right away. If you are taking tretinoin, it's important not to donate blood and to avoid handling the medication if you are pregnant or may become pregnant. This drug should not be used during pregnancy, as it may harm an unborn baby. It is also not recommended to breastfeed while using this medication and for 1 week after the last dose, as it is unknown if the drug passes into breast milk. Be sure to consult your doctor before breastfeeding while using tretinoin. When using tretinoin, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. It's not possible to list all potential interactions, so it's crucial to keep a record of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this information with your doctor and pharmacist. Do not make any changes to your medication regimen without consulting your doctor first. Some products that may interact with tretinoin include certain drugs that prevent bleeding, tetracycline antibiotics, and vitamin A. Be sure to discuss with your healthcare provider any concerns about potential interactions with tretinoin. Remember to follow your doctor's instructions carefully and take tretinoin as prescribed for the best results. If someone has taken too much tretinoin and is experiencing severe symptoms like fainting or difficulty breathing, it is important to seek immediate medical attention. In the U.S., residents can call their local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. Before taking tretinoin, it is important not to share this medication with others. Additionally, you may need to undergo lab and/or medical tests such as complete blood counts, liver function, blood cholesterol, and triglyceride levels while taking this medication. It's important to keep all medical and lab appointments and consult your doctor for more details. If you forget to take a dose of tretinoin, take it as soon as you remember, unless it's less than 10 hours until your next dose. In that case, just skip the missed dose and take your next dose at the regular time. Don't take a double dose to make up for the missed one. It's best to take tretinoin at the same time every day, to help you remember. You should store tretinoin at room temperature, away from light and moisture. Do not keep it in the bathroom. Make sure to store all medications away from children and pets. Remember, do not flush tretinoin down the toilet or pour it into a drain unless instructed to do so. When it is expired or no longer needed, be sure to properly discard this product. You can consult your pharmacist or local waste disposal company for more information on how to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.